This would be part 2 of this osteopathic education we're getting here in a nutshell. The origin. So where does this all come from?
Okay. Well, this is in 3 parts, and today is part 2. We did part 1 last week, and I sent slides to you, Bill, that are going to be posted on your website there so people can follow that. I've got 3,412 slides, so I won't go through every one of them.
All right. Really?
But basically, where it comes from is a fellow by the name of Andrew Taylor Still, who in the 19th century, he was a physician out in the Midwest, Missouri, Kansas, and so forth, and he was a Civil War surgeon. And he became very disenchanted with the medicine of the time. And he said, most people, if they stay away from the doctors, first of all, they don't get an amputation, and secondly, they survive. And he said to find health should be the object of the doctor. Anybody can find disease. So he started looking into, how is it that people can actually recover from illnesses, without medicines and so forth. As a researcher, he was looking into a number of different things that are on the slideshow here, things that he was reading. He was an avid reader. There was a cell theory that came out in the 19th century. Before that, they thought that tissues like muscles and skin were made of tissue. But then this guy, Virchow, he talked about the cell theory, that cells come from cells. So even infection comes from other cells or bacteria. And that they have a nerve supply and a blood supply. Louis Pasteur, the guy who gave us, one of the guys who gave us the germ theory, said that the infections don't just happen or come from smells. There's germ theory. And also showing that, if you had a certain environment in either making wine or cheeses or beer or in your own body, if you don't have the proper circulation and nerve supply, that you will have fermentation. Just like wine will turn to vinegar, in the same way, areas of your skin are prone to infection. And so Andrew Taylor Still, he put this all together, the cell theory, the germ theory, and also the autonomic nervous system that communicates with our tissues and our nervous system. He put it together and said, there must be an inherent healing process that is inherent in the body. And what we need to do as physicians is bring out that healing, because that's where it comes from. Our healing or compensation comes from the inside, not from the outside. So he started devising a bunch of physical techniques, if you will. And you mentioned osteo. He decided to call it osteopathy. Mm-hmm. Osteo, bone, pathos, meaning something is wrong or a disease. And I wish he would have called it leveropathy. Archimedes once said, if you had a lever long enough and you give me a place to put it, I can move the world. Well, Dr. Still, what he did was he said you have a hand or a fist or a knee or something as a fulcrum, and then you use an arm or a leg as a lever, and you can then get stretching or pressure into nerves or vasomotor centers or stretching of tissue and so forth, and you can then get better movement out of the neck or the shoulder or the hip, and eventually you will restore motion and circulation to that area. And so I wish he would have called it leveropathy. Yeah.
And can I ask you too about when I was dealing with the cancer issue a year ago? I had a friend continuously telling me it is so important to have the right frame of mind. You have to be positive. If you're thinking negative or you're getting depressed over it, it is going to have an effect on your recovery. You have to be positive. So if that has any truth to it, the mind plays a big role in all of this as well.
No question about it. In fact, that brings me to the next point with osteopathy. Osteopathy, first of all, is a philosophy. I talked about the levers and all that stuff, the physical part. But osteopathy is a philosophy. First and foremost, that the body is a unit. And you mentioned the mind, body, and spirit. The body's a unit. Secondly, the body always tends to some level of compensation or healing that I mentioned. And lastly, structure and function are inversely and intimately intertwined. You change the structure of something, you change its function. So, for example, you mentioned the mind. The mind is being part of mind, body, and spirit. If you change the structure of the mind, okay, and what I mean by that is maybe your habits, your outlook on life, and so forth, your socialization, whether or not you have humor, forgiveness in your life, and so forth, then your function changes. You get a better outlook on life. Your relationship with people changes. And it's been shown that there are hormonal changes and neurologic changes that occur along with the change of the positive thinking.
It does play it seems like it does play a role. That positive thinking is extremely important when it comes to all of that.
In fact, a lot of times I will have patients come in and they might have something like a headache and a neck problem. And maybe I'll be examining them. I'll do a neurologic exam, osteopathic exam, a structural exam, and so forth. And I may work on their upper back and their neck and their head, doing some of these leveropathy or stretching techniques or slight pressure in different areas. But invariably, I'll ask them things like, how's your day been? Do you sleep well at night? What is your general mental attitude? And we'll talk about those things because they are just as important or even more important than what I'm doing physically.
Yeah. And then there's something in your slides that we'll put on in the story when we do it later about treatment of shingles. So an osteopathic treatment for shingles. Well, because that's a topical. How does that work?
Well, first of all, the shingles is the chickenpox virus, and it resides in the paraganglionic ganglia in the nervous system, and it somehow, for some reason, gets activated, and the virus actually travels out along the nerves in various areas, and that's why you'll see where there's a nerve, let's say, to the buttock and the leg, you'll get a rash, a painful rash, or this one patient I had recently, a few of his ribs there, the nerves followed along the rib, and the picture I showed shows a similar rash there. Well, he was treated with an antiviral. We treated him with that and a steroid, and he had some pain medication, and that pretty well subsided, and the rash was just about gone, but he still had severe pain along the ribs. And I said, part of the problem with the pain is that you get local swelling on a cellular level, and you get blockage of the lymph or the sewer system, if you will. So I used a series of techniques there on the mid-back area and then on the ribs, freeing them up. And then basically one thing I did, I took the tip of my thumb and milked the lymphatic system along the ribs there back to the spine. And I did that a few times. He had almost instant relief. And when I saw him again a week later, he had no symptoms at all.
Wow.
And this something where he had pain for 5-6 weeks, something like that.
Do you suggest people getting recommend people get the shingles shot, and if so, what age?
I do suggest that they do get the shingles shot. There was a previous one, Zostrix, and now the new one is Shingrix, and you get one, and then about a month or so later, you get the second one on there. It is very painful. The problem with shingles is that after you're done with that, there's a small percentage of people who end up with chronic pain. I remember seeing some patients when I was director of the ER at Little Falls, and there was a fellow who would come in every once in a while with severe pain from his previous shingles. It was up in his shoulder and arm, and it would be so bad he would occasionally have to have a Demerol shot.
Wow.
This is years after his shingles.
Wow.
Yeah, so it's not like the common cold.
What age do you suggest people get that?
Well, as far as the shingle shot, usually it's about 50 to 55.
Okay.
On there.
All right.
To get.
All right. So we'll post all of this up on the website, and people can check it out. Anything you want to add to this, Doc?
Yeah. Aside from I show some case studies where I've treated people for things like the shingles, their knee problems, and so forth. Lately, I've been interested in the post-COVID syndrome. There was a study out of Italy that came out just last week, and it seems that people who definitely had the COVID, 6 to 8 weeks later, still have extreme fatigue, joint pains, chest pain, and shortness of breath. And I've seen some of the people in our area here who weeks later still were suffering from symptoms there, although no fever or anything. And we treated them with osteopathic techniques, including a thing called the VIP treatment, the viral infection protocol, VIP treatment for post-COVID syndrome. And people turn around, many of them turn around quite quickly.
Yeah.
So that's one of the treatment protocols that we're using at the Falcon Clinic.
There was a story that I saw yesterday about just what you're talking about, the symptoms that happen after COVID. And there was a guy that he had a temperature over 100 for over 70 days. His temperature, he ran a temperature for over 70 days. And that's post-COVID. Right. Crazy, right? Somebody asked me the question just quickly.
But a lot of these symptoms, you talk about fever, things like that. Everybody treats a symptom as if it was a disease.
Yeah.
The fever means that for some reason that person's immune system is still working overtime.
Still fighting it. Yeah.
Yeah. So you might do other supportive things like osteopathic treatments. A number of people talk about different medications. I don't want to get into. It's a political football.
Yep.
But things that can be done on there to support the person's health.
And then someone asking, can you get shingles twice?
Yeah, you can. It's very rare, but I have seen it, and I've been convinced that, yes, it can happen again. Possibly the person's immune system did not react well enough the first time.
Interesting. All right, Doc, thanks so much. It's the Falcon Clinic. You can reach out to their website. Of course, we'll have this up on ours later on this afternoon.